Thank you so much for joining in. Let's give a round of applause for everyone for your patience and your great networking. I feel the starters were amazing, so if they were tasty, we need to really clap louder. So I welcome you to National Healthcare and Wellness Conference Award 2024, a premier gathering dedicated to exploring the latest trends, innovation, and breakthrough in healthcare, wellness, and holistic well-being. We are excited to bring together a diverse group of thought leaders, practitioners, and industry experts who are reshaping the healthcare landscape. In today's rapidly evolving healthcare environment, it is crucial to navigate the challenges and embrace the opportunities that arise. This conference is designed to foster meaningful discussions, inspire action, and spark collaboration towards a healthier and a more innovative future for all. Our esteemed speakers will address critical and timely topics such as preventive healthcare, cutting-edge treatment modalities, and an integration of technology in wellness practice. In addition to the insightful presentation and panel discussion, we are thrilled for launching both a HealthFirst, a magazine that we are launching in both print as well as digital formats. HealthFirst will serve as a dedicated platform for sharing thought leadership, experts' insight, and the latest updates in the healthcare and wellness sector. We are also honored to recognize the outstanding contributions of individuals and organizations in the healthcare sector during our prestigious award ceremony. Those are all out there. I'm sure everybody is looking there, but we have to have some time and patience. These awards celebrate excellence, innovation, and dedication, showcasing the remarkable achievements that are shaping the future of healthcare in India. So, also let me introduce to you about the organizers, that is Hardman Media Ventures. Today's prestigious National Healthcare and Wellness Conference Award 2024 is brought to you by Pearson Hardman Media and Hardman Ventures. Let's give them a round of applause, everybody, for this beautiful initiative. Hardman Media Ventures goes beyond traditional PR and marketing. This is a company that crafts powerful brand stories and help businesses to grow, building meaningful connection and their audiences. Their dedicated team of professionals brings together innovation, strategy, and creativity to shape impactful narratives that resonates deeply. As a part of an ongoing mission, they're also proud to launch again the HealthFirst, that's a brand new magazine in print and digital formats, offering a cutting-edge insights and fresh perspective to healthcare advancements. Now, it's a time for us to take a little moment. I would like everybody to stand for silence and pay our tribute to Sri Ratan Tata Ji, reflecting on the enduring values and principles he has imparted to our nation. His vision, integrity, and commitment to excellence continue to shape and inspire us. This will be followed by our national anthem. Janagana mana adhinayaka jaya bharata bhagya vijata Punjab Sindh Gujarat Charabanga Vinda Himachala Yamuna Ganga Uchala Jalasikara Tava Shubha Name Jage Tava Shubha Ashish Mage Janagana Mangala Nayaka Jaya He Bharata Bhagya Vijata Jaya He Jaya He Jaya He Jaya Jaya. In Vedic tradition, lighting a lamp, particularly at the beginning of a conference or auspicious events, holds deep symbolic meaning. Here are some of the reasons that I would like to acknowledge. The first is knowledge and wisdom. As is it said, when light comes, ignorance disappears. Second is invocation of the divine blessing of Goddess Saraswati. And third is symbol of hope and positivity to foster collaboration, progress, and shared growth. Now I'd like to invite our chief guest and guest of honors to come on the stage for lighting the lamp. Let me start with our chief guest, Suyash Jadhav, Indian para-swimmer. Suyash Jadhav, an extraordinary Indian para-swimmer, competing in the S7 category. Suyash is the only para-swimmer to have achieved the A qualifying mark for both the Rio and Tokyo Paralympics. His stellar career includes multiple medals at international championship and prestigious awards like the Arjuna Award and Eklavya Award. Unfortunately, Suyash is stuck in Goa, so we'll be having a live video with him. But before that, I want to show you a small video of Suyash Yadav.
India's only swimmer at 2016 Rio Paralympics. इनके हौसलों ने दिलाई है इन्हें एक अलग पहचान।
इंसिडेंट के बारे में बताइए जिस के बाद से आपकी लाइफ पूरी तरह से बदल गई।
जब मैं 6th स्टैंडर्ड में था, आई थिंक 2004 में, मेरे भाई की स्कूल में शादी थी और शादी से पहले एक दिन मैं स्कूल पे खेलने के लिए गया और ऊपर से इलेक्ट्रिक लाइन गई थी। वो स्टील रॉड होते हैं ना कंस्ट्रक्शंस के लिए, तो मैं उसको हाथ में लेके बैलेंस बना रहा था, तो वो स्टील रॉड उसका बैलेंस नहीं ठीक से बन पाया, इसलिए मैंने दूसरा हाथ भी लगा दिया, फिर भी वो उसको चिपक गए। सो उसी में मेरे दोनों हाथ को करंट लग गया। लगभग 1 साल में हॉस्पिटल में था, लेकिन कुछ फायदा नहीं हुआ, मेरे दोनों हाथ उसी में चले गए। उस टाइम से लगा कि मैं अभी स्विमिंग नहीं कर पाऊंगा। पापा के तो पूरा सपना खराब हो गया था, सब फैमिली डिस्टर्ब हो गई थी, उनको पता नहीं था कि अभी क्या करें।
जब आप रियो ओलंपिक से वापस भारत आए थे तो आपके फोन पर एक मैसेज या फोन आया था हमारे देश के प्रधानमंत्री, उसके बारे में कुछ बताइए।
एक्चुअली जब हम रियो से वापस आ रहे थे, जब हम एम्स्टरडैम में थे नेदरलैंड्स में, किसी के मोबाइल में चार्ज नहीं था, किसी के मोबाइल में कुछ प्रॉब्लम था, तो मैं ही अकेला था कि सबसे पहले वहां पे जाके वाईफाई कनेक्ट करके मेरा व्हाट्सएप चेक किया, तो मैंने देख लिया अपने पीएम साहब ने सबको पैरालंपिक के जो भी प्लेयर है उनको 24 को बुलाया है। बिलीव नहीं कर रहे थे हम कि वो हमें बुला सकते हैं वो मिलने के लिए।
नहीं, आपको विश्वास करना पड़ेगा कि हमारे देश के प्रधानमंत्री बड़े खुश हुए थे पैरालंपिक्स में जब इतने सारे मेडल हम लोगों को मिले। आप अपने गोल को अचीव करने के लिए अपने आप को किस तरह से फोकस रखते हैं?
गोल को अचीव करने के लिए सबसे ज्यादा मैं अपने ट्रेनिंग पे ध्यान देता हूँ, उसके बाद कंसिस्टेंसी, मतलब जो भी मैं ट्रेनिंग करता हूँ वो कंसिस्टेंसी में, मतलब कभी सेशन मिस नहीं करता हूँ।
जो काम हमें चुनौती लगते हैं, सुयश के लिए वो काम हर रोज का नॉर्मल रूटीन है। सुबह उठने से लेकर स्विमिंग पूल तक उनका दिन वैसे ही बीतता है जैसे किसी और एथलीट का। पहले मैं अपनी और अपने देश की तरफ से उनको थैंक यू बोलना चाहूंगा। थैंक यू सुयश, हमें पॉजिटिविटी की नई डेफिनेशन सिखाने के लिए। थैंक यू हमें इंस्पायर करने के लिए, हमारा रोल मॉडल बनने के लिए। थैंक यू हमें सेल्फ कॉन्फिडेंस की ताकत बताने के लिए। थैंक यू सुयश, हमें ये बताने के लिए कि प्रॉब्लम नहीं सॉल्यूशन है जिंदगी। ओलंपिक्स का मोटो है फास्टर, हायर, स्ट्रॉन्गर, और सुयश की भी सोच तेज है, एम हाई है और इरादे स्ट्रॉन्ग है। ओलंपिक्स में जीत से ज्यादा जरूरी है कंपटीशन में हिस्सा लेना। सुयश के लिए भी ये जरूरी नहीं कि उन्होंने क्या हासिल किया, बल्कि ये जरूरी है कि हासिल करने के लिए उन्होंने कितनी मेहनत की।
Hi Suyash, good morning.
Hello, hi, good morning.
नमस्कार।
नमस्ते नमस्ते प्रहलाद।
आज हम आपको बहुत मिस कर रहे हैं इधर।
अरे थैंक यू सो मच, लेकिन अभी मतलब आई एम रियली वेरी सॉरी, ये थोड़ा फ्लाइट का इशू हो गया, इसीलिए मैं फिजिकली वहाँ पे नहीं आ पाया। सो वर्चुअली करना पड़ा।
आपका प्रेजेंस ऑलरेडी इधर है, हमने आपका वीडियो देखा है एंड सल्यूट टू यू फॉर द कॉन्फिडेंस। एंड बोला जाता है कि व्हेन गोइंग गेट्स टफ द टफ गेट्स गोइंग, आपने वो पूरा प्रूव किया है। आपको
you,
सारी
thank you, sir.
जनता देख रही है, हमारी पूरे ग्रुप ऑफ पीपल आर लुकिंग वाचिंग यू, आप कुछ कहना चाहते हैं उनसे?
So you're asking about my journey or
Absolutely,
what?
your journey, your experience, and what is something that you would like to share with us, all of us?
See, आप देख सकते हो मुझे, मतलब आपने अभी वीडियो पे देखा मुझे दोनों हाथ नहीं है, तो I'll share my journey, how I started swimming and how I get into the swimming competitions. So before that, I would like to tell you my father also was the national swimmer, but due to some cyclone or some reason, he couldn't participate in that year competition. So उनकी जो अधूरी इच्छा थी वो मैं पूरी करूँ, इसीलिए एट द एज ऑफ 3 और 4 उन्होंने मुझे स्विमिंग सिखाया। और व्हेन आई वाज इन, आई मीन जब मैं 6 स्टैंडर्ड में था, तो उस टाइम पे मेरे भाई के एक स्कूल पे शादी थी, और स्कूल के ऊपर से एक इलेक्ट्रिक लाइन गई थी। तो वहाँ पे मैं शादी से पहले एक दिन खेलने के लिए गया था, और ऊपर से इलेक्ट्रिक लाइन गई थी, मैं आयरन रॉड के साथ खेल रहा था, तो अननोइंगली वो जो आयरन रॉड थे वो वायर को टच हो गए, एंड ड्यू टू विच मुझे बिलो एल्बो दोनों हाथ मेरे एम्प्यूटेट हो गए। सो उसके बाद मेरे व्हाट अबाउट माय करियर, व्हाट अबाउट माय फ्यूचर, व्हाट अबाउट माय फादर्स ड्रीम, ये सारी चीज़ों को लेके मेरे पापा बहुत ज़्यादा परेशान हो गए, बहुत चिंतित हो गए, अभी क्या करना है, क्या कुछ समझ नहीं आ रहा था उनको। तो इसी में 1-2 साल 2-3 साल चले गए, फिर पापा को पता चला, ही केम टू नो दैट पैरा स्विमिंग कंपटीशन भी होते हैं, और उनको पता चला कि स्टिल आई कैन स्विम, स्टिल आई कैन गो टू द कॉम्पिटिशन। सो उन्होंने मुझे उसके हिसाब से प्रिपेयर किया, और मेरी फर्स्ट स्टेट लेवल कंपटीशन नासिक में हो गई, उसमें काफ़ी अच्छे से परफॉर्म किया, फिर नेशनल के लिए सिलेक्ट हो गया, इन अगेन नेशनल में काफ़ी अच्छे से परफॉर्म किया, और इन दिस वे फ्रॉम 2007 टू टिल द डेट मेरी स्विमिंग जर्नी स्टार्ट हो गई। सो ये 3 पैरालंपिक्स में पार्टिसिपेट किया, काफ़ी अच्छे से परफॉर्मेंस हुआ। देन अगेन 2018 में मुझे एक एशियन पैरा गेम्स में गोल्ड मेडल मिला, और वो गोल्ड मेडल मीन्स इंडियन पैरा स्विमिंग हिस्ट्री में एशियन गेम्स में फर्स्ट गोल्ड मेडल था। सो आई एम द अलोन स्विमर टू विन फर्स्ट। थैंक यू सो मच। एंड उसके बाद अभी 2023 में जो एशियन गेम्स हुआ, अगेन एशियन पैरा गेम्स, उसमें भी मुझे ब्रॉन्ज मेडल मिला। सो वो कंपटीशन में आई एम द अलोन स्विमर टू विन मेडल फॉर इंडिया इन एशियन पैरा गेम्स in 2023. So yeah, all those are my achievements, and अभी तक since 2007 to till date more than 125 में स्टेट नेशनल इंटरनेशनल लेवल पे में मुझे मेडल मिला है। So this is my brief information about my journey and my achievements.
थैंक यू सो मच वंस अगेन सुरेश जी। मुझे एक पूछना है कि हम लाइफ में बहुत कंप्लेंट्स करते हैं कि लाइफ में ये चीज़ ठीक से चल नहीं रही है, बिजनेस ठीक नहीं हो रहा है, बॉस अच्छा नहीं है, ओके लेकिन आपकी लाइफ में तो आपने बहुत बड़ा संघर्ष करके यू हैव वन, यू कम योर, ओके आप एक क्या ऐसी मैसेज हम सबको देना चाहते हो ऑन द वेलनेस कॉन्फ्रेंस, जिससे सबको एक लर्निंग हो सके कि यस if this is for me I could do wonders. So ऐसी कुछ टिप हमें दे सकते हो आप?
फर्स्ट ऑफ ऑल मैं एक एज अ मोटिवेशन मैं ये बोलना चाहूंगा कि इफ यू कैन सी मी, आई डोंट हैव बोथ हैंड्स। सी हियर आई डोंट हैव बोथ हैंड, बट मैं उसी बारे में कभी नहीं सोचा। डोंट थिंक अबाउट योर डिसेबिलिटी। I don't see my disability, I see my ability and what I can do with my ability. So इसके बारे में मैं सोचा, और मैं अच्छे से स्विमिंग कर सकता था, मैं अच्छे से बाकी सारी चीज़ें कर सकता था, उसके ऊपर मैंने ध्यान दिया और काम किया। सो डेफिनेटली मैं यहाँ पे पहुँच गया। सो डोंट थिंक व्हाट यू डोंट हैव, थिंक ऑफ व्हाट यू हैव एंड वर्क ऑन इट। डेफिनेटली यू विल गेट व्हाट यू वांट। ये मेरा एक मतलब मेरा खुद का एक मोटिवेशनल सेंटेंस है। एंड अपार्ट फ्रॉम दैट मैं ये कहना चाहूँगा कि हमारे मतलब एक स्पोर्ट्स पर्सन के लाइफ में एक डॉक्टर या स्पोर्ट्स साइंस, ये सारी चीज़ों का बहुत ये वेलनेस चीज़ों का बहुत ज़्यादा इफेक्ट होता है। अगर आपको डाइट करना है या आपको मतलब छोटी छोटी सी चीज़ें भी अगर आप पकड़ ले, लाइक डाइट, आपको अगर डाइट चाहिए तो आपको ब्लड सैंपल करना पड़ता है। अकॉर्डिंगली आपको क्या डाइट चाहिए, आपके प्लस माइनस पॉइंट्स क्या है वो आपको पता चलेंगे। सो ये सारी चीज़ें बहुत मैटर करती है। सो इसमें स्पोर्ट्स साइंस का या न्यूट्रिशनिस्ट का ये बहुत इंपॉर्टेंट रोल करता है.
Thank you so much once again, Suresh. From the anyone from here would like to ask any question to Suresh? How do you feel listening to Suresh's story?
Inspiring.
Okay, it's saying inspiring. आपकी story बहुत inspiring है, Suresh. So
Thank you so much.
We are really missing you today. You are our chief guest, but to see you here is such a.
I'm really very sorry for that. I'm not there. So yeah.
Not to worry. Pearson Hardman team is really feeling gratitude and thank you. It's an honor to have you here. So anything before signing off you want to say, Suresh? Before signing off करने से पहले कुछ कहना चाहते हो?
मैं मतलब I have shared what I wanted to share. I have shared that. But if you guys have any kind of questions, do let me know and tell me if you want to ask. I'm very much happy to tell you.
First of all, thank you for making us proud, our country proud, and all the best for many more competition, many more success in your journey of life. Thank you once again, Suresh Yadav. Thank you, and we will miss you today.
Thank you so much.
Okay,
Thank you.
take care. Bye.
Yeah, thank you. Bye.
Thank you, everybody, for listening to Suresh Yadav and his contribution. I would now like to invite our guest of honor on stage, Mr. Partha Sarthi Biswas, the esteemed assistant editor of the Indian Express. Let's give a round of applause to Partha Sarthi Biswas. With a keen eye for impactful storytelling, Partha brings to light the vital narratives that shape our society. Join us in welcoming him as a guest of honor at the National Healthcare and Wellness Conference. Thank you so much for having you here. Yeah. The next, I would like to invite Sadashiv Madane, co-founder, chief advisor of Prakshik Bahudeshiya Sanstha Mumbai and vice president of Mumbai Graduate Forum. Namaskar. Next, I would like to invite Dr. Kashinath Bangar. He is the founder director of the Painix Clinic, Pain Management Clinic in Pune. Let's give a round of applause to Dr. Kashinath. I would also like to invite Rajabhau Haral, Medical Association President, Chemist and Druggist Association. Please welcome Rajabhau Haral. And the fifth one, the last but not the least, is me, Dr. Paras. Dr. Paras Wellness Director and the Director of Section 8 Company Inner Universe Education Foundation, offering free certification program on mental health and wellness locally and globally. I would like to request everybody to proceed further towards lighting the lamp. Invite Dr. Kashinath Bangar. There's a request. Rajabhau Haral. Please come. I would request the Pearson Hardman team to offer a welcome bouquet to our chief guest and guest of honors. Santosh, would you like to come on the stage? Shekhar, Santosh, Prajakta. Let's give a round of applause to our guest of honors. There are no taxes for clapping. Let's give a round of applause to everyone. Thank you, Santosh, once again. Thank you so much for joining in. Please take a seat. Can I request Partha Sarthi Biswas to share his thoughts on the role of conference in shaping the future of healthcare and wellness?
It's really nice to see a room full of very positive and healthy people. Health, we do know, is wealth, but unfortunately, these days, health and healthcare has become very complicated. The When Shekhar broached the subject of this conference, I was pretty excited because I knew something very good is going to come up. In this room full of people who are involved in healthcare, I'm sure we are going to find out and we are going to discuss and deliberate on the recent trends, how we can make ourselves a more healthy society. Like WHO says, the definition of health is not just lack of physical ailments, it's the complete well-being, mental, physical, and psychological well-being of a human being. So along with our medicines, we need to have different kinds of things so that we need to have a 360-degree holistic look towards health. With I'm sure the esteemed speaker are going to talk about it and going to deliberate it. Well, I have a bit of a background of health in the sense that I am a bit health conscious. I used to play football in college and I did continue certain parts of it, not the football part. But I understand, like, if you are healthy, you can work really like 24/7 and yet not be disturbed, but you need your rest. So I hope and I am sure this is going to be a grand success, and thank you for calling me here. Thank you.
I would also like to invite a special guest of honor, that is Santosh Handal, Assistant Teacher Kalyan, RSP member in Kalyan. Can I invite Santosh Handal on the stage? Can I invite the Pearson Hardman team to offer him a Tulsi plant? Thank you for joining me. Just a token of love and affection from our team. So moving ahead now, would love to invite our next keynote speaker, Dr. Ravi Godse, MD Medicines from KEM, Bombay, and MD from University of Pittsburgh. He has been practicing medicines for the past 20 years. However, he is also a filmmaker who has brought an evolution with his films like Remember Amnesia, 2019. The movie Help Me Help You, 2009. The movie Dr. Ravi and Mr. Hyde, 2007. The movie I Am Schizophrenic and So Am I, 2008. He is one of the very few directors who have finally connected entertainment with medicines in all of his films. Now let's get ready for a panel discussion. We'd like to explore from our experts their thoughts on preventive healthcare and chronic disease management. May I call upon our experts to join the panel? Let me first start with Dr. Yogita Birud. She is the founder of Mindwell Homeopathy Diet and Yoga Clinic, where patient-centered healthcare is the priority. With a focus of holistic treatments combining homeopathy, nutrition, and yoga, located in Ghatkopar and Dombivli. Dr. Birud's expertise ensures an exceptional healthcare experience, promoting overall well-being through integrated care. I welcome Dr. Yogita Birud. Please come on the stage. Let me invite our next expert is Mr. Mandar Gadre. He is a PhD. Dr. Mandar Gadre is an IITian serial entrepreneur, a metabolic health consultant. As a founder of FitHolic Studio, he combines physical fitness with a focus on metabolic health to help individuals put chronic conditions into remissions. With a scientific approach, Mandar has successfully guided clients managing and reversing conditions like diabetes, hypertension, PCOD, and obesity. I welcome Dr. Mandar Gadre. Please come on the stage. Yes. Our next expertise, can we give a round of applause to Dr. Mandar Gadre as well? Yeah, everybody, yes. Yeah. Our next expertise is Dr. Richa Purohit. She is a seasoned physiotherapist with over 15 years of experience, holding a bachelor and master's in physiotherapy from Bhopal. She is a registered member of the Indian Association of Physiotherapists and a founder member of the Society of Physiotherapists in Pune. As a founder of Fitwell Physiotherapy, Dr. Richa specializes in pelvic floor rehabilitation and is actively involved in women's healthcare awareness campaign. More power to you. And our next expertise is Dr. Mahesh Sadashiv Adwarkar. is a practitioner in naturopathy, yoga, and chiropractic. Dr. Mahesh his team has successfully treated over 25,000 patients using a holistic approach that includes massage therapy, cupping therapy, acupuncture, and various other natural treatments. Their mission is to empower individuals to adopt healthier lifestyle and avoid ill through comprehensive natural health methods. So in this session, I welcome Dr. Sadashiv. Please come on the stage as well. Yes. And the session will be moderated by Lopamudra Das. She's a nutritionist and women's fitness specialist. May I invite her as well on the stage? Thank you so much for joining us. Yes. Thank you so much for joining us. As we all know that we started a bit late, okay, and the panel discussions are full of wisdom. So we have dedicated 30 minutes, 25 to 30 minutes for every panel discussion. And I have this beautiful gong, not to, so that it can be mesmerizing, it can be very hypnotic. So the moment I, ring this gong, I would like everybody to be aware that it's 25 minutes and we have last 5 minutes for conclusion. Okay? So over to you, Lopamudra.
Hi, everyone. Good morning. How is Saturday treating you? All good? So everyone is looking beautiful, gorgeous, shining. And today we are talking about health. So I think looking good, fit, energized is a part and parcel of health. So yes, I'll make some space for you. So why I'm saying that you all are looking good, I'm also looking good, right? Say please, yes. So I believe in affirmations, and I believe that when we want to bring some changes, we start believing that we already are. So with that note, I'll start today's this insightful panel discussion about preventive measures, preventive healthcare, and how these chronic diseases can be treated, chronic disease management. So with that note, I will just want to bring that note because this chronic diseases like diabetes, obesity, heart diseases. We used to know earlier that it comes to diabetes especially, that it will come after 50, 60, we are fine, we are in our 20s, 30s, 40s, we are good. But unfortunately, this is not the case right now. I started knowing about juvenile diabetes. Obesity starts from very early stages. So it's very alarming that how it starts so early. So I would like to know about all the experts today that how we can prevent these chronic diseases with your expertise, with your strategy, then we can discuss and know more about it. So I'll start with today's first question, open to all. This preventive healthcare has come a major focus in reducing the burden of chronic diseases. In your expertise, what role do you think that lifestyle changes and early prevention and this proactive healthcare can prevent this and we can keep it in our mind? So I'll start with Richa.
Yes, thank you. And a very warm welcome, everyone. Hello. Definitely, preventive healthcare has a major role in your overall health improvement. I am a physiotherapist. I call myself a movement specialist because I basically work on your movements. Movement is something which is the best thing to make you healthy. Coming to the preventive healthcare, definitely if you are aware of your own health, if you know that you will be, for example, as she mentioned, Lupa mentioned that diabetes is a chronic disease. Yes, it comes from heredity as well. So if you know that you have a family history and if you are aware of certain things, you can work on your lifestyle changes, you can delay or you can prevent yourself from that particular disease. If you are an office employee, if you have a sedentary lifestyle, you are prone of getting n number of health issues. So if you are aware and if you can change your lifestyle, if you can change your food habits, your activity level, you will definitely can lead a better life. The third part is education. Education, it means the self-awareness part. So definitely preventive healthcare, and as a physio, we call it preventive physiotherapy. There is a myth that people feel that physiotherapy is needed only if you are sick, only if you have pain. But no, the latest concept is preventive physiotherapy. Preventive physiotherapy will definitely help you leading a better life. If you're into sports, if you're into any activity, we will do the assessment. We find out what is your body requirement, and accordingly we prepare your body to not to get injured. So again, prevention is better than cure. So better
course.
so if you are injured, if you are suffering, you will have to spend more. So please be in your budget and work on your preventive health. Thank you.
So what do you think, Ms. Richa? Now you can probably say that what are the approaches we should take care firstly?
First thing is definitely a good lifestyle, having a healthy lifestyle, good eating habits, exercising, keep moving. I am a certified ergonomist, and as an ergonomist, I take n number of corporate health talks, and I feel very disappointed when I see people, the employees who are into mid-20s, mid-30s, they are having back pain, neck pain, slip disc issues. That is very disappointing
We
because
feel younger to them.
exactly. So yes, my advice to them is please stay healthy, stay fit. It's not that you have to go to gym every day. You have to lift 50 kgs every day. It doesn't matter. You just have to be active, stay fit, stay healthy. That is my advice to them.
So, being a homeopath
Thank you.
doctor and a yoga therapist, so I always seen in the preventive. When we say preventive, it's not like with one or two things we can prevent all the things. It overalls your immunity. So immunity builds with the 5 things. First one is the good diet, good sleep, good thoughts, then exercise, and the last part, when you are getting ill, then what medicines you prefer. So if you're preferring all these medicines which increase your immunity and combining all these 4 points together, then definitely the preventive health will comes together automatically. With the working lifestyle right now and the way we are working all the day with the stress and with the thoughts, with the fast life routine, obviously all these changes are very necessary to maintain the preventive measures. Second thing, when we go to the preventive, it's a maintenance part. It's not like you do only one time and it gets covered. It's like all the time you have to keep covering and you have to focusing on it. So how you will increase the awareness of your body, then there yoga always comes into it and it helps into it, making your mind aware. So all these things definitely helps into the preventive part and you have to maintain it.
So if you can put some inputs from your side.
हेलो, मैं डॉक्टर महेश अडोलकर, नेचुरोपैथी एंड कायरोप्रैक्टर। एक्चुअली प्रिवेशन में क्या है, नेचुरोपैथी में लोगों को लगता है कच्चा खाना, कच्चा पीना, यही सब नेचुरोपैथी
Right.
है। एक्चुअली वैसा नहीं है, उसमें भी काफ़ी है। आप योगा करते हैं, डाइट मेंटेन करते हैं, टाइम पे खाते हैं, टाइम पे सोते हैं, तो भी आप उसमें काफ़ी प्रिवेशन ले सकते हैं। उसमें भी आपको काफ़ी इम्प्रूवमेंट हो सकती है। अभी क्या हो रहा है, हम टाइम पे नहीं खा रहे हैं, टाइम पे नहीं सो रहे हैं, जो खा रहे हैं वो सब ऐसा ही खा रहे हैं, वो सब उसके ऊपर हम ध्यान देते हैं तो भी काफ़ी हमें हेल्प हो जाती है उसमें।
Can be as a preventive measures they should start with it.
It's your lifestyle ना, you
Right.
take a lifestyle, eat healthily, do exercise every day. It's a good.
Everybody faces
Yes.
this doing workout every day. It's a
Yes.
tough job. I know.
So when I think of lifestyle changes for prevention, right? So first thing I usually help people understand is that all of these chronic lifestyle diseases, they have their solution in the name itself. They have happened across decades, and we have ignored some fundamental aspects of our health, and that is why they have occurred. So we have to sort of go back to those roots, understand those building blocks of our health, and then work on those. And as the other panelists have said, this is going to be a work in progress, right? We cannot let it go, right? So we have
It's
to
not a one-day job.
Absolutely. So it's all about finding the key where we have lost it. Not because it's not hidden in some bottle of pills. It's truly there in the lifestyle. So we need to go to the root causes. And when I work as a metabolic health consultant, we help people understand the core of metabolic health, which impacts all aspects of our well-being. And that's how I look at it.
My next question is for you, Yogita. As a homeopathic doctor, homeopathy is important in preventive.
I would like to say that homeopathy is not only the preventive, but it's curative as well. So when I go into the chronic disease, the chronic disease doesn't develop in a very shorter duration. It always with a longer duration, and it's present in the body since so long. When I say the homeopathy, how it will help into it, then homeopathy has an aspect which is working on the mental level, physical level, and spiritual level. So now if you see into the chronic disease is having two types of, like, one is the completely reversible and the second one is irreversible. So when we go to the reversible, then homeopathy has a fully potential to come to the reverse the disease and make completely cure with the root cause itself. But when we go to the irreversible pattern, then in that case, we always need to take with the conventional medicines, where it comes role with the combined therapy. So with the combined therapy here, there always be a need that which medicines are required to control the disease will require that medicines, but in that situation, when the side effects get much more and the generals are getting worsening, then again there is a role of homeopathy which works on the mind level also, and it helps to patient to overcome from the chronic diseases. When we say like the diabetes, asthma, and the chronically severely where the gross pathology is already developed, and then patient comes to the homeopathy, then it's a very challenging job. There you cannot leave the even conventional medicines, neither you can leave the homeopathic medicines. There it's a completely equal and 50-50% rule, and then you can slowly reverse, not completely reverse, but I can say you can increase the much better level of health. So in the level of health, when you see that you need to maintain the vital energy of the patient, it is like you can be a grossly severe pathological ill, but if your vitality is good, then you can overcome that disease very easily. So here again, the homeopathy has a role that it works on the spiritual aspect as well, and it completely cures the whole aspect. Like many medicines are based on the behavioral pattern also. Like in a particular disease, if the patient's behavior is different, then the medicine is get completely changed, even though the disease name is similar. So this kind of approach always I combine in my clinic, and I help in the chronic diseases to all my patients.
Yogita, so if my question is, do you use any innovative or any technology to help the patients, or do you suggest anything which can be implemented?
In the technologically, if I say that there are certain fitness apps, like they can monitor the heart rate, then we can use that in the emergency level, pulse rate and all. But apart from that, now it's a digital and global platform is there. So I personally have set up my own mobile applications for my patients and the patients who are not in India. So I handle all these patients from that platform, and I easily get connect with them, because in homeopathy, like many medicines are already we can give to the patients before even the diagnosis of the particular disease. Like, because earlier I said that it works on the completely pure symptom similarity basis. And then later on, definitely we also need a diagnostic. It's not like that we never do a diagnosis, but we can start medications and we don't need to wait for the diagnosis. It's like on the behavior and the symptom based, we can immediately start the medicines. Not sometime, but every time it's like the technological, when we say ki without technology now, it is even not homeopathy is working. Because the repertorization base, the case-taking base, and the whole materia medica is based. It's like we need to rely on the softwares. Because without that, we can't completely go into the classical homeopathy. But of course, when there are acute cases, we don't need to completely depend on the softwares. Because it's the knowledge which we have developed in our practice, where we can immediately identify the medicines, which medicines we have to give. So it's not 100% technology, it's experience with technology.
Doesn't matter how much AI is here, how much machinery things are here, but still human intervention, nothing can replace it completely. Thank you so much,
Right.
Dr. Yogata. It was very insightful for me. My next question is, Dr. Manda, to you. So, diet and exercise are often considered as pillar of our health. So, in your experience, what do you think is the biggest misconception people still have dealing with these chronic diseases?
Right. I think the biggest misconception is that you can outrun a bad diet. This I say as somebody who runs a fitness studio, runs a gym. But we have been sort of told that whatever has gone wrong for our internal health, for our metabolic health, right, can be compensated by doing more exercise. So whenever diabetics come to me or people suffering from PCOD, fatty liver, or even obesity, they come to me, I help them understand that the open secret in our industry is for these types of conditions, more exercise is not the main answer. It of course helps, but it's not the main answer. So I sort of look at it as having twins in your house. If one is hungry, you cannot feed the other twin more food, right? So if it is gone wrong in terms of your internal health, then that's where it needs to be fixed. And if it is going wrong in terms of your physical fitness, so if you are getting, back pain, neck pains, as we were discussing, or if you are not able to complete some simple physical tasks in your day, of course your fitness is what is missing. So just a clean diet is not going to help you. That arrow people understand, but the reverse they may not understand. So that I think is the biggest misconception. The second minor one is that we have also accepted the deterioration of our health very, very quickly. I mean, in your TV serials and movies, when they want to show that some elderly person is getting taken care of, all they really show is the youngsters in the house are giving them medicines on time, right? Nothing else. So we have to really ask that why are these medicines being required for years and years? If they are required for a short time, that's fine. So that's the other misconception that because you're advancing in age, this is going to happen. That's an absolute misconception. So I think those are the two big ones. And thirdly, of course, we are not really hitting at the root cause, but we can discuss about that.
In a sustainable way, what do you give advice, and somebody probably never into workout or never into any proper routine, so what you can suggest
Absolutely.
that's sustainable for anybody?
Right. So see, we have been categorizing the advice that we get in two buckets, right? Either I find this advice as sustainable and this advice as not sustainable. So that is happening because somebody else is giving us a plan. Okay, so when either people are getting some workout chart or diet chart or whatever, right? So that plan is not being developed with that person's participation. So what I do is that I remain only as a guide, and then I help that person develop an actual lifestyle plan by working with them for several weeks or several months. And when they have developed the plan, that is going to stay. Otherwise, if I give them a piece of paper that can go on their refrigerator and very soon it's going to fall into the trash bin, right? So sustainability will come only if you have developed the plan. I am there to help you do it, but you know the constraints of your life and your household much better than I do. And also we have to realize that we have to compare correctly. So which means that if people say, okay, this is not sustainable to me, the comparison is not with some hypothetical third way out, which will also let me do whatever I want, but also not make me sick. That doesn't exist. So the real comparison is with a chronic disease, and so those costs need to be compared correctly. When people compare them correctly, they find that many of these things suddenly become sustainable.
Is look for the motivation from doctors, and I guess more than motivation, if it comes from inside that I have to make some changes, then it is really, really sustainable. Motivation doesn't really work very well for the longer run. What do you think, doctor?
So as I was saying, motivation will work, right? Because for somebody who has been suffering from diabetes or weight gain or PCOD and all of that, right? They have to wake up one day and compare that journey of 15-20 years.
Right.
Then, so I cannot, implant that motivation in somebody's head. They have to look around and realize that our hospitals are right now full of people. 90% of them are all chronic conditions. So that's the major load. And tomorrow I'm going to land up there, right? So I think the motivation has to come from within. People like us can only help sort of nudge somebody else.
So my next question for you, Dr. Richa. As a physiotherapist, you work closely with patients who are recovering from any sort of injury or any sort of accident that happened earlier. So how do you see physiotherapy playing a preventive in managing those chronic diseases? What are your inputs into this?
Yes, definitely. So, physiotherapy starts when a child is born. Even a premature baby, having respiratory issues, having delayed milestones once he or she starts to grow up. Physiotherapy plays a major role. Excellent recovery we have seen. So, definitely, we cannot stop or we cannot delay the premature birth. If the child is born and if we know that these issues might definitely trouble the child, then we start working on the child immediately, giving them some respiratory measures of physiotherapy interventions. We have respiratory physiotherapists. So physiotherapy has different branches. It's not that we only treat pain. It's not that we only prevent injuries. We have cardiorespiratory physiotherapists, we have pediatric physiotherapists, sports physiotherapists, gynecological physiotherapists. So we all are working in specific fields to prevent the injuries first, but if the injury has happened, we will treat the injuries. Coming to the teenager girls having menstrual issues, having then the pregnancy-related issues in women, then perimenopausal issues in elders, and then again in elderly people, geriatric care we do. In case of preventive physiotherapy, first we advise people to have how the diagnostic people do, how the pathology labs, what we do, we have a plan that every year we'll do a health checkup. So in preventive physiotherapy also, we advise people to have preventive health checkups with under a qualified physiotherapist. We do the proper assessment of the person. We do assess the requirement, the body requirement. We check the entire history, the family history, their lifestyle history, and then accordingly we customize the protocol, customize the plan. It's not that one exercise suits all. It's not that one size fits all. So every individual has a different need, a different requirement. So accordingly we customize their protocol, we customize their lifestyle habits and the exercises, and that is how we work, and we are getting great results in all these preventive measures.
Thank you so much. My next, just a question to my point of view, that what are the strategies you will suggest if I really want to pinpoint that, okay, these are the strategies somebody can really use?
Yes, while I was listening to Dr. Yogita, I'm really glad that she is of the same mindset what I am with, that all these AI apps, the latest technologies, they are not worth it. Our hands are magical. God has given us those skills, that knowledge, that power, that we can do the assessment better than the AI apps and everything. So no matter technology, jitna bhi aage badh jaye, is really hats off to the technology, but our knowledge and our skills are far more better. So yes, we do use some posture analysis apps, but it is for the clients who are not able to visit. I prefer them to meet me at least once. Just let me check their body, let me check do their assessment. Then what I do personally in my clinics, we give them a treatment protocol, we give them few sessions. After that, we have an online support program going on. In that online support, now we know that particular person, we know their individual complaints and their needs. Then we put them into the online exercise programs, and we have made a protocol of 6 to 8 weeks of that exercise protocol. Mostly the major group of people, they fit into one or the other exercise program, and that way we make sure that, and we believe that if you are doing exercises for 6 weeks continuously under our guidance, you will do it lifetime. Because
that's amazing.
There is a particular time period, right, when the body adapts, then the body demands to work on your own self. So that exercise protocol which we have been using is really working wonderful, and it is working for all age groups and for almost all the conditions.
That's beautiful. So do you have any tip for the daily posture that we all screw up almost, I think?
Yes.
So, that I get to hear many, almost every day that, okay, wrong posture. So do you have any quick tip for all of us that we can follow?
Yes, so I can see people sitting here and I don't see anyone sitting in a good posture. So if you're sitting, please make sure your spine is in a good curve. Never imagine that the spine is straight. The spine is not straight. The spine is curved. So you have to maintain the curves of your spine. If you're working if you're an office employee, you have to make sure that you're supporting your lower back curve with a small cushion or a small pillow. Then you have to look straight. If you're working on a screen or desktop, make sure the screen is at the eye level. Generally what people do, the screen is at this level, they are working continuously in this position. That's going to hurt your spine. The body is meant to be balanced. We are imbalancing it by our poor posture. So maintain a good posture and take frequent breaks. ज़्यादातर patients आते हैं, they are like 2 घंटे 3 घंटे में हम break लेते हैं. We suggest 45 minutes. Set alarms. Take breaks after every 45 minutes. If you're not able to walk around, just sit and fool your body that you're exercising. Just move. And I'm sure that will help you. Thank you.
Even when you are watching Netflix, make sure after each episode you take a break.
Yeah.
Thank you so much. Thank you so much, doctor. So talking about when we mix and correct blend of machine and human touch, talking about with that points, I'll go to Dr. Mahesh, that your correct blend and increasing demand of integration of approaches combining modern techniques and our old methodologies. So what are your inputs to prevent chronic diseases with your expertise into this?
एक्चुअली बहुत लोगों को नेचुरोपैथी क्या है यही पता नहीं है पहले.
Even me too. I want to know more.
इनमें से भी काफ़ी लोगों को पता नहीं होगा. कितनों को पता है नेचुरोपैथी क्या है? हार्डली 2-3 लोग हैं. वही तो होता है. नेचुरोपैथी में मेन क्या रहता है, रूट कॉज ऑफ द डिसीज दिखते हैं. और नेचुरोपैथी में मेन हम क्या बेसिक प्रिंसिपल क्या है, हमारी बॉडी जो है पृथ्वी, आप, तेज, वायु, आकाश, इन पंचमहाभूतों से बनी है. जब भी आपको कुछ बीमारी होती है, आप उन्हीं के सानिध्य में फिर से जाते हैं तो आपकी बीमारी ऑटोमेटिकली कवर हो जाती है. अपना बॉडी जो खुद की, हम जितना हम डॉक्टर है खुद की बॉडी का, दूसरे कोई डॉक्टर नहीं है. जितना आप आपके बॉडी को समझ सकते हैं, दूसरे डॉक्टर कोई नहीं समझ सकते. मॉडर्न मेडिसिन में क्या होता है या मॉडर्न टेक्निक में क्या होता है, आपको एसिडिटी हो रही है. मैं सिंपल एग्जाम बता देता हूँ. एसिडिटी हो रही है, हम सोचते नहीं कि क्यों हो रही है. मैंने कुछ गलत खाया है, मैंने रात को लेट खाना खाया है, लेट में सोया हूँ. ऊपर हम सुबह उठ के क्या करते हैं, एक ओमेज ले लेते हैं, काम पे जाते हैं. एक्चुअली वो एसिड रिफ्लेक्ट होता है, वो बाहर निकलना चाहिए, पर हम नहीं निकालते, उसको अंदर दबा देते हैं. नेचुरोपैथी में हम वही बोलते हैं, उसको नेचुरल प्रोसेस है, ये निकलना चाहिए. आपको कॉन्स्टिपेशन है, हम ध्यान नहीं देते, हर रोज़ कुछ ना कुछ खाते रहते हैं, वही आगे जाके पाइल्स में हो जाता है, कन्वर्ट हो जाता है. यही बेसिक चीज़ें रहती है. कोई भी बीमारी हमें ऐसी ही नहीं आती, उसके हमें पहले सिम्टम मिल जाते हैं. उस सिम्टम के ऊपर हम काम करते हैं ना, तो क्रोनिक बीमारी आती नहीं है. इसलिए इसमें प्रिवेंशन बहुत इम्पोर्टेंट है. तो हम वही सजेस्ट करते हैं लोगों को, आप छोटी छोटी चीज़ों को आप इग्नोर मत करो. उसी टाइम पे आप ट्रीटमेंट लेते या कुछ करते, आगे जाके कुछ आपको ट्रीटमेंट लेने की ज़रूरत नहीं पड़ती. और नेचुरोपैथी में ट्रीटमेंट नहीं रहती है, सिर्फ आपकी लाइफस्टाइल हम चेंज कर देते हैं.
एब्सोल्युटली. सो आप हम लोगों को कोई एक सिंपल सा एग्जांपल जो आप पेशेंट को आपने इम्प्लीमेंट किया है, बोथ द टेक्निक्स जो उन लोगों को बहुत हेल्प किया, ऐसा कोई अगर हम लोगों को एग्जांपल दे पाए?
एग्जांपल इसमें पहले मैंने बोला आपको, एक तो एक्सरसाइज चाहिए. एक्सरसाइज कोई भी करो, जिम करो, योगा करो, कार्डियक करो आप, या फिर अपना ये कुछ भी, आपको स्विमिंग करो. हर रोज़ डेली एक्सरसाइज होनी चाहिए. दूसरी चीज़, आपका खाना टाइम पे चाहिए. मॉर्निंग जो भी है आपका ब्रेकफास्ट का टाइम, और हर रोज़ खाने में आपको ग्रीन सलाद चाहिए, ग्रीन वेजिटेबल चाहिए. वो आप लेते हैं तो आपको काफ़ी इम्प्रूवमेंट हो जाता है.
और टाइम पे सोना कितना इम्पोर्टेंट है व्हेन यू टॉक अबाउट एसिडिटी?
बहुत इम्पोर्टेंट है. एक्चुअली कैसा है, रात को पहले हम 8 बजे खाना खा के सोते थे, अभी 12-1 बजे लोग सोते हैं. और दूसरी चीज़, रात का खाना और आपकी नींद, उसके बीच में कम से कम 3 आवर का गैप होना चाहिए. जनरली लोग 11 बजे खाते, 11:30 को लुढ़क जाते हैं. वैसा नहीं होना चाहिए. और अर्ली मॉर्निंग सुबह 6 o'clock उठना ही चाहिए.
सो डॉक्टर, आप जब उनको ट्रीट करते हो, कितना आपका मेंटल जो हेल्थ हम लोग बोलते हैं और एसिडिटी, कितना वो लिंक है?
बहुत बहुत कोई भी बीमारी हो, आपका खाना, आपका टाइम पे सोना, आपकी लाइफस्टाइल उसके ऊपर डिपेंड है. जनरली मैंने वही बोला, हम नेचुरोपैथी में क्या सिखाते हैं लोगों को, आपकी लाइफस्टाइल चेंज कर देते हैं. अभी सर बैठे ऐसे टेढ़े बैठे, अचानक उनको कर्व आ जाएगा या पॉकेट रखा होगा.
सो ही विल कांटेक्ट रिचा देन.
आपने पॉकेट रखा है ना पीछे, पॉकेट रखा है ना पीछे, ऐसे रखते तो फिर साइट का प्रॉब्लम आ जाएगा आगे जाके. मैम को भी पता है, वो पोस्चर करेक्ट नहीं ना, ठीक से बैठना चाहिए. हर रोज़ कुछ ना हो तो कम से कम 10 सूर्य नमस्कार आप डालिए, आपको कुछ नहीं होगा. एक्स्ट्रा कुछ एक एक्टिविटी करने की भी ज़रूरत नहीं है.
तो आपको आपकी तरफ से
बोलते हैं हमें टाइम नहीं है, बहुत आपका बिजी शेड्यूल है, 10 सूर्य नमस्कार डालने के लिए 10 मिनट लगते हैं. एक सूर्य नमस्कार 1 मिनट में हो जाता है. उतना भी आप करते हैं ना तो भी काफ़ी है उसमें.
Right. Thank you so much, doctor. It's wonderful insight from you. Any question from our team, our audience? Do you want to ask any question from our experts?
Maybe I'd like to ask one question, Dr. Richa, that in the corporate world today, we see, or in manufacturing, mainly in the management job, a lot of life is sedentary. You sit, you work. Okay, what kind of basic exercises that you would recommend? Maybe because you do a lot of corporate programs, I've seen that. I've spoken to you personally as well. So anything that you want to share, show, would be great for us to everyone.
I would like to demonstrate rather than speaking.
Excellent, excellent. Yeah.
Okay, so for corporate people, I always listen from the people that we are not getting time. We're continuously in calls, right? 2-2 घंटे के calls चल रहे हैं. How to do exercise? What to do? You know, or we are in the office. We are not ready to exercise in front of our colleagues. We can just go. We can have tea or a coffee or a water, and we'll come back. We'll sit. So my advice to them is always you can do desk exercises. Come in groups. Ask your friends to join you, ask your partners, and then you can sit together, do some desk exercises. So I have personally designed some desk exercises for the corporate employees. I can demonstrate if ma'am you can help me. That would be great if you all can join us in this desk exercise. That way you'll remember also next time when you are working, after 45 minutes break, you can do this. So it's not that after every 45 minutes you will have to repeat these desk exercises. In one break, you can go for a washroom break. The second break, go have some tea, coffee. Third break, make sure you're exercising. Fourth break, again, you go for a walk. Fifth break, anything else. Sixth break, again, exercise. So at least make sure that 2 breaks you are doing these desk exercises. So if you all can join me, I would be really glad. So my focus is in breathing patterns. What generally people are missing is they don't breathe when they exercise. Breathe as in they tend to hold their breath when they're exercising. For example, if they are doing any stretching, they will do the stretch, they'll hold their breath, they'll hold the movement, and they'll release. It makes no sense. Your body needs oxygen. So please keep breathing. So just follow my instructions and do these few exercises I'll explain.
Thank you, Rachel.
So the first one is, you just have to sit straight. Again, sit straight doesn't mean sit straight because the spine is curved. So make sure that you have a good support at your back or the spine is curved. Just take a deep breath, close your eyes, just focus. Close your eyes, take a deep breath through your nose, breathe out through your mouth. So, we will repeat. Breathe in. Breathe out. Next time when we breathe in, you have to imagine that you are moving. So, not imagine, like you have to move. So just hold your arms. You have to breathe in, relax your body. You have to breathe out, bring your arms up. Try to move your body up, stretch your body up as much as you can. Breathe in and you have to relax. We are not holding it. So just understand the instructions. Breathe in, relax your body. Breathe out, pull yourself up, stretch yourself up, feel taller as much as you can. Breathe in and relax. We will repeat. This time we will hold. So breathe in, relax. Breathe out. Now hold the movement. Breathe in, breathe out, breathe in, breathe out, breathe in and release. So this is just an example of how we do. Because generally if you'll stretch, you'll hold the breath. So you have to make sure you're not holding the breath. So this is one example. Other example, just do simple neck movements. Five movements in all the directions are sufficient. So front and back, side movements, side bends, and half rotations front, half rotations back. Coming to the shoulder, quick shoulder rolls. 5 shoulder rolls front, 5 shoulder rolls back, and relax. Coming to the upper body, so just hold your arms in this way, just twist, back, twist, back. Remember the breathing pattern, breathe in, relax, breathe out, move, breathe in. Breathe out, move, breathe in. 5 repetitions are more than enough. Bring one hand up. We are working on the breathing muscles now, because if you are in a bad posture, your breathing muscles are compromised. You will not be able to breathe good. So, hand up, breathe in, relax, breathe out. Bend on your side. You should feel the stretch in the intercostal muscles, which are the breathing muscles here. Breathe in and relax. Same 5 repetitions. 5 repetitions on the other side. Breathe in, relax, breathe out. Stretch yourself. Breathe in and relax. Coming to the lower body. So, just spinal twists we do. Coming to the hip joint, quick march, sit and march. Just sit and march. Coming to the knee, just knee bend and knee straight. Ankle toe movements. You're done with your full body exercise.
Can I add something? Yeah. So when you are on a screen, it's a 10 by 10 rule. 10 seconds you will see the screen, and 10 seconds you will see outside. Again 10 seconds screen and 10 seconds outside.
Yes, that's the eye exercise. Yes, eyes do need stretches. Full body का तो हम stretch कर लेते हैं. What about the eye muscle?
Yeah.
So in order to avoid the strain to your eye, we call it 20-20-20 rule. After every 20 minutes, take the eyes off the screen, look at something 20 feet far for 10 seconds, as ma'am mentioned. Relax, repeat, relax. You will never get strain in your eyes, and because of the strain in your eyes, sometimes we get headache, neck pain. So I'm sure you'll be free from all these things if you'll follow these simple tips.
Thank you so much, Dr. Richa. It really helpful. Dr. Yogita, I have my one personal question to you. So in the time of, we all want very fast inputs, fast results every time, everything wants instant coffee type. So in this time, how do you keep the patience in your patients, that homeopathy?
That's a very wonderful question.
Yeah.
But again, it's a knowledge and awareness. So ideally, the word fast itself is a wrong word. There is nothing fast results. It always slow is the fast. Whatever the slow, it is always the fast. So we actually had the wrong concept and myth that we have carried out. The same way yoga also supports it, and same way homeopathy is also supports it, and all other alternative paths like naturopathy. These I cannot say it's an alternative, it's a mainstream actually. We have made it alternative. So the way, like as also I said earlier also, the how we manage our illness is the prime importance role in our health. From the childbirth to the old age. It's not about only diet, it's not about only sleep, only exercise, it's the thoughts also and the medicines which you take all the time. If you take the medicines which enhance your immunity, you will definitely reduce the chronic diseases in your lifestyle. And once you go into chronic, there is to come back, it's very difficult and challenging. That is the maintenance. So again, it comes under into maintenance where the patient gets tired to do the medications all the time. So prevention with the cure, it's all combining together. And there, to keep this awareness, the patient ko lana, it is the difficult challenge. But once they realize that here is not a fast terminology exists, hai hi nahi, there is no terminology of the fast. It is always slow is the fast. Same for the study, same for your career, or same for your finance also. And for everything, it is slow is the fast.
Because sometimes I say this to my clients that I don't cook Maggie, that you will, 2 minutes result. So it needs dedication, it needs some perseverance to see the inputs. And yes, that's why I really personally wanted to ask this question from the time I met you.
Yeah, thank you.
Thank you so much. Thank you so much. And with that note, I would say that there is no fast result, and prevention is actually the cure. Prevention is better than cure. And when we can prevent all those chronic diseases like diabetes, heart diseases, obesity with our little lifestyle changes, not too big, one day at a time, and implementing those steps will really make a great result in your health. Thank you so much, all of you, and your expertises. I hope that will help everyone today. Thank you so
Thank
much.
you for the Pierman and Hudson that they have given us the platform.
Absolutely.
And for the listener also, those who are listening to us very patiently. So thank you so much.
Thank you so much once again, and may I request everybody, the Pearson Hardman team, to get us a Tulsi plant so that it signifies healthy life leading to a healthy nation.
Thank you, Paris.
The session was so powerful that even my gong did not do any magic. So let's see what happens next. But before that, let me share this event is brought to you by Pearson Hardman Media, our primary organizer. We're also proud to have Harman Market Insight as associate partner, helping us ahead with the latest industry trends. Moving to the next segment, I would like to invite our next series of individual speakers who will share their knowledge and empower our minds. The timeline for every speaker is 10 minutes. And on the 9th minute, I shall ring the bell. If that does the magic, let's see. I would like to invite our speaker, Dr. Kashinath Bangar, founder director of the Painix Clinic, Pune, a pioneer in the field of pain management, which is making exceptional contribution to the healthcare community. Today, Dr. Bangar is going to speak on regenerative therapy, a breakthrough solution for knee pain relief. His work in the area focuses on using regenerative techniques such as PRP and stem cell therapy to treat chronic knee pains, which a focus on avoiding surgical procedures. So I'm very personally keen to learn more about it. I welcome you here. Please come.
Thank you very much. It reminds me of the one of the dialogue of our time. इतने बड़े country में छोटी-छोटी चीजें तो होती रहती हैं. So I thank Shekhar for giving me an opportunity. Shekhar, thank you very much. What appealed to me today is the name of the conference, National Healthcare and Wellness. So probably it, is looking onto a very, very broad term conference. Today we'll see what are the various, see there are by and large, there are, if we take any condition, any disease, there are few parts of that disease. One is it starts before you realize that disease has started. And it can be treated, it was a wonderful panel discussion. It can be treated at that point before it starts, simply by correcting the posture and everything. Second, it goes into the stage where something has caused that disease and now you are into the treatment phase. Even there are 2-3 phases of the treatment. We look any disease by and large. A simple few changes, dietary, lifestyle changes will help you in modifying that disease. Another is it's reached beyond the stage where these changes, probably the disease has reached the stage where these changes will help in preventing a further damage, but will not treat the present condition where you need something else. And one more stage is now it has gone into the stage where the surgery is needed. Of course, apart from that, to prevent the recurrence, you again need lifestyle modifications, which includes everything, right? So today I'm going to talk about one stage where the disease has gone beyond the lifestyle modification and where it needs some assistance. And I am really blessed to have a regenerative therapies in our hand. So where we few conditions like early osteoarthritis knee. See this, the terminology is very important. Early osteoarthritis knee. Advanced knee osteoarthritis does not get reverses. Meniscus partial tears, ligament tears, partial tears, muscle and tendon tears. These are the knee is by and large form of some bones, muscles and tendons. If there is a partial tear, if there are few changes, that definitely can be treated by the regenerative therapies. Osteoarthritis, we all know, is age-related condition. It was 60, 50, now 40. We don't know where we are leading. 40 years of their age. And few things that happens is pain of the affected joint, pain not responding to the medicines, grating sensations, swelling, inability to sit, squat, sometimes deformity and stiffness. These are the few of the symptoms of the osteoarthritis. Once we take the x-rays of the patients, you can see from that side the very nice joint where are no any changes. Then it starts advancing, the disease starts advancing into grade 1, 2, 3 and 4. What exactly is mean by a regenerative therapy is, regenerative therapy basically aims regenerating the damaged part. So it helps in healing in short. And in regenerative therapy, there are basically few of the therapies in which either blood of the patient is taken, the same patient, or the bone marrows are taken, or some external factors are kept inside the body so that the healing starts faster. And few things are bone marrow therapies, where we aspirate the bone marrow of the patients, we process it, and after processing the part which has been processed, we put it into the damaged part. How do we put? We take the help of the sonography machine, ultrasound machine or x-ray machine. These are basically therapies. We do it in an operation theater or operation room. This is not a surgery. Bone marrow is a wonderful, one of the wonderful, thing which we have available. Second therapy is PRP. PRP, you must have heard about the platelet-rich plasmas, where we take out the blood. Approximately 4 ml of PRPs we get up into the 40 ml of the blood. Very simple process. We just spin the blood and the PRPs are separated. There are methods, close methods, open, close, semi-close. Growth factor concentrate. Last few days we are working onto the growth factor concentrate, and we found that the growth factor concentrate, again the one of the component of the blood, the name suggests, we separate the growth factor and put back into the area which has been damaged. It has been suggested that adipose tissue, the fatty tissues, also some factors from the fatty tissues can be separated and put into this. These first 4 are the body parts of the same individual, which can be separated from that individual. The last 2, like prolozone or prolotherapy and ozone. Prolotherapy is basically 12.5% to 25% dextrose. We put it into the joint. And the ozone. Ozone is a simple, there is some machine which converts oxygen to ozone. We put into the joint. Now, how does this works is last 2 parts, prolotherapy and ozone. This induces the inflammation. And basically the healing happens by the inflammation. First few parts, we separate the healing factors. There are 1, 2, 3, 4, like PRP is growth factor on bone marrow, and then we put into the joints. As I said, we take the help of the advancements into the technologies like CT scan, if we want to go into the deeper, live CT scan, live sonography. And that's how it helps in regenerating. So what are the advantages of the regenerative therapy? The simple advantage is these are the non-surgical treatments. As it is, first 4 parts are taken out from your own blood. There's nothing, though there's no steroid. In fact, steroids and the painkillers are contraindicated when we are using the regenerative therapies. Simple daycare procedures. It is used mainly in chronic conditions, which has gone beyond the, very conservative methods of management. Usually anesthesia is not needed, healing is faster, recovery time is minimal. But is that all? No, it's not that all. Once we do the regenerative therapy, after an weeks of the rest, we have to go for the good rehabilitation to the patients, because no single therapy never works. Are there any disadvantages of regenerative therapy? As of now, we are finding the first disadvantage is it's not covered by the insurance, and we are behind the insurance companies. Even we had, behind the government of India to take this to the regenerative therapies, because, of course, as I said, the patient selection is very important. Not every patient's, now I'm talking about the knee, suppose, not every patient's having the knee pain or age-related degenerative changes of the knee does not get reverts with the regenerative therapy. It is a specific particular category of the patients that gets reverts. Beyond that, these things will not revert. So it is not like, 100% magic, or there's no 100% answer to any single disease. So there are some limitations. Accessibility, as on today, not more medical institutions are into this. There are institutions which are coming, even we are teaching to our students to come into this, but we need a little more focus onto the institutions to talk about the regenerative therapies in a correct way. It is simple spinning machine. We take out the blood, we spin it, we double spin it rather. This is a closed system, what we preferred and we ask everyone to use, because in closed system, once you put blood into that system, you need not to withdraw it for the second spinning. And the PRPs, you can see that this upper lighter part, it looks like that PRP. We have seen the concentration of the PRP. We check when we do the blood concentration. Usually the blood level is 2 to 5 lakhs per cubic mm. Here we get at least 3 times, 14 to 15 lakhs per cubic mm. And for the knee, as I said, it's not the only regenerative therapies. It could be either regenerative with or without other combinations. For example, intra-articular lubricant injections, you must have heard, these are very commonly given as on today. Sometimes we have to combine the lubricant injection with regenerative therapies. And the few advancements are like cool radiofrequency. I will definitely finish 1 second before my time. So like cool radiofrequency ablation, this is one therapy where non-surgical treatment for the patients who don't want to undergo a TKR, or where the post-TKR is pain. That TKR is knee replacement. So if they do it, then regenerative therapies can be taken. Last 2 cases, 27-year young stunt man come to me. He told me he has he fall and he had a partial meniscus tear, and the next his stunt is with Ranveer Kapoor, approximately. That is what he told, a 200 crore movie. And he want to quickly go to the stunt because it is one of the biggest challenge. 3 sessions of GFC, and as on today, he probably was about to start this stunt. He might have started. Second thing, 56-year female, early ONE. Physiotherapy was difficult due to pain. Same, we do the 3 GFC sessions, the 3 PRP sessions here, and patient is almost 90% pain-free. Thank you very much for your patience learning. I again thank Shekhar and team for giving me an opportunity. You do exercises, preventive thing in time, don't get into the disease. If you are into the stage where the disease has incurred, do treatments like regenerative therapy. You will not go into the surgical thing. And if you are to that area where the surgery, you are gone into surgery, please get it treated and go to the good rehab.
So I have a question for you. Like as you said, what are the diseases covered under the under the pain management, typically the non-surgical process?
Yeah, so thank you very much for the question, because the interventional pain management, pain and spine management, this is relatively a new branch into that. This is an allopathic branch basically. All we are either we are MBBS, then MD or MS, and then fellowship into pain management. Orthopedic surgeon, anesthesiologist, neurosurgeon, these are and rehabilitation, these are the categories where these people are eligible for practicing pain management into India. Where, as I said, we treat mainly a spine-related, ortho-related conditions without surgery, and neuro-related, nerve-related, like migraines, frozen shoulders, spine, post-spine surgery syndromes, TKR or post knee replacement surgery syndromes, pain related to the cancer, and the end of life care. So these are the main categories, and one of the important is sports injuries. So these are the categories we do treat, of course, with the help of our, we need a psychologist, we need a physiotherapist, we need a big team with us. Thank you very much.
Thank you so much once again. Please stay on the stage. I would request, let's give a round of applause to Dr. Kashinath. And may I request, yes, you have a question?
Are there any age-related limitations for regenerative therapy? For example, have someone very old, so does it works?
No. So I will answer both the questions. You ask one question and I'll answer the second as well, which you didn't ask. So any limitations to age-related conditions? No, there are no any limitations to the age-related conditions. But yes, sometimes we have to choose something over the other. So what we found is in elderly patients, the growth factor and PRP works better than the adipose tissue, or the bone marrow works better than the adipose tissue. Second challenge comes is not directly related to age, but indirectly related to age. We don't want this patient on ecosprin, on any steroid or any painkiller. So we have to stop it at least 2 to 3 weeks before giving this therapy, because these two therapies antagonize each other.
So what are the precautions and the maintenance after the therapy is done?
So after the regenerative therapy one is, as I said, all these drugs which are contraindicated should be stopped at least 1 week before. After the PRP therapy or after any regenerative therapy, at least 1 week of strict, I'll come, 1 week of strict rest to that point. Whatever the joint or whatever that tendon should be given. And after that, you have to strictly follow the rehabilitation protocol. So that becomes very much your part. So these are the two things. And meantime, it takes 4 to 6 weeks approximately for complete healing. So you cannot go with full strength till 6 weeks is there. Post-COVID, we are getting a tremendous patient of vascular necrosis. Grade 1, 2, excellent result. Grade 3, borderline results. Grade 4, usually only regenerative doesn't work. So either it is either the THR, hip replacement, or the cool radiofrequency ablation, where we don't reverse it, but we decreases the pain. But first and second degree, excellent results.
Meniscus and osteoporosis. And my question is related to, does it have any extra impact on the woman health? Because women are more prone to osteoporosis. And is there any preventive measure that should be taken care?
Yeah. So osteoporosis, I think I didn't mention, but osteoarthritis, early osteoarthritis. See, as I said, the patients into different category. One, before it happens, is all your area. Once the patient is into osteoarthritis, then I need to put in a regenerative therapy.
Is there any preventive measure or that should be taken care?
Prevention for the osteoarthritis.
Yeah.
Good, as you told, good exercise, regular activities, and the good diet. These are of course, along with that, we have to take care of the hormone replacement therapies as well, the calcium and these things. But yes, those are the good replacement.
Thank you.
Therapies. Thank you.
Thank you so much once again, Dr. Kashinath. I would like you to stay on the stage here for a minute. Can I request the PSN admin team to get us a Tulsi?
So, this is an perfect example of good anchor and, all-rounder. So he knows what, if it is not there, I'm here, don't worry. The show must run on. Please, big round of applause to him. That's wonderful.
Inspired by the earlier session, keep moving. So moving on to next, I think these questions were amazing. I think thanks once again, Dr. Kashinath, for your wonderful contribution and the work that you're doing. I would like to invite our next speaker on the stage. That's Dr. Ashwini Shirsat, a pediatrician and neonatologist. Dr. Shirsat holds an MBBS, DCH, and DNB in pediatrics from Mumbai. And her specialities include newborn care, pediatric ICU management, and addressing conditions like asthma, respiratory infections, and dermatology and type 1 diabetics. Today, she'll be speaking on a very crucial topic, that's advancement in childcare, nurturing the next generation. Let us put our hands together for Dr. Shirsat for sharing her valuable insights. Please come on the stage, ma'am.
Thank you, everyone. Today, my topic for discussion is pediatric health, and in that, advancement in child care, nurturing the future generation. So, today I'll be discussing on innovations in pediatric healthcare and treatment, then nutritional strategies of healthy child development, importance of early childhood development and support, role of technology in monitoring and enhancing of child health, and some success stories. So first of all, innovations in pediatric healthcare and treatment. So I would like to begin with in earlier days we were not able to survive a baby who is nearly 1.5 kg, 1 kg, but due to the advancement in technology, we can provide a baby a same environment which is like a mother's womb. We can create such environment outside the mother, and then we can even survive a 500-gram baby. So it's a big advancement in a pediatric healthcare. The second thing is drugs. There are multiple drugs. I'll again go with the same example. Earlier, we as a baby needs maturation. Baby will take 9 months for his whole maturation. Like baby needs to be matured by lungs, heart, even intestine. So by giving some medication outside the mother's womb, we can create such environment. We can mature the baby's lung. We can mature baby's intestine. We have that facility so that we can survive a baby who is even 500 gram. So these are the main interventions, innovations in pediatric healthcare. Again, one more very much add-on to the pediatric innovation is vaccination. Earlier, we used to see many kids getting ill because of infectious disease. Now we are not seeing much of infection because we can vaccinate them. Like we do have vaccination for simple flu vaccine. Every yearly we can give our kids a flu vaccine. Even deadly diseases like meningococcal meningitis, pneumococcal vaccine, we do have availability of this vaccine so that we can prevent our kids from infectious disease. Now coming to more, like we can prevent even a cancer. Like we do have HPV vaccine, which is useful for preventing cervical cancer, vaginal cancer in females. In addition to that, we can also prevent our boys from having anal cancer, oral cancer, and we can use HPV vaccine in boys also. So in boys till 15 years of the age, we can use HPV vaccine also for prevention of those cancers in boys also. So the next thing is nutritional strategies. I don't think we need to go beyond natural things for nutrition in health. I feel old is gold for nutrition in kids. We need to make balance between carbohydrate, protein and fats for healthy diet in children. That's it all. We don't want fancy things. We don't want burger. We don't want pizza. We don't want French fries for our kids. We just need a balanced diet which is very healthy. We want chapati bhaji, we want green vegetables, we want salad, we want everything. Not we want fancy foods. No, old is gold for nutrition in child. That is best strategies, I would say. So don't fall for this packaged foods and we have this much of sugar, we have low sugars. No, nothing like that. Every natural food is free of sugar. So we don't have to run behind the packaged foods which claims we have no sugars in our packet. No, it's not like that. So prepare fresh food at home and give it to your boys and girls. So that's the best thing. The second thing is children should have the maximum amount of fiber in their diet. We come like in our OPDs, most of time parents complains about the constipation. Most of time because their diet is not full of fibers. Their diet is full of this carbs and everything, and it's refined sugar, maida and everything. Because burger and everything it made up of like maida only. So lack of fibers can cause such problems. So we need to provide diet which has higher amount of fibers. And the third thing, most important, is water. Children are busy in their routine, playing, doing games and everything, and they just ignoring to drink water. So we want to make sure our child drink as much as water he or she can in a day. So drinking water is most important for kids. Nowadays we come across a thing like we need to intervene a baby in early stage of life. It is necessary, but I must say ki it is necessary because most of child's brain development is in earlier age. Like brain development is till 2 years of the age. So we, as much as we can provide the stimulation to child's brain will function more, and he or she can learn the more things in first 2 years of their life. Nothing else. There is no rocket science. We need to intervene in first 2 years of the age. So हम लोग क्या करते हैं कि बेसिकली वी यूज टू डू कि नहीं ये छोटा बच्चा है फिर भी उसको स्क्रिबल बनाने सिखाएंगे. नो, इट्स नॉट पॉसिबल. वी नीड टू फॉलो सर्टेन एज, and after that certain age baby is going to learn. There are some apps and there are some social media platform which says ki no your baby can learn these things fast. No, your baby can learn this. No, it's for the baby to learn certain things there are certain limitations and we need to follow. We can't teach our 1 year old baby to do like climbing and everything. He can't do. He can walk that time but he can't climb and he can't run. So we need to go step by step. We need to see age appropriate toys, age appropriate apps, and we need to go by that only. The next thing is role of technology in monitoring and enhancing of child health. So here again I would say everything which has come new in the pediatric technology, some are good things, some are really not good things. So coming to technology, if we say some health monitoring tools like we do have smartwatches. By smartwatches we can see how is our baby's daily activity, how much he can play, how much is daily exercise, and for some matter we can identify our son or daughter, where is she or where is he, what they are doing. For that matter, it's good. Even we can say there are some devices by which we can monitor blood sugars in babies, where a baby earlier stage, we call it as type 1 diabetes. We monitor continuous blood sugar monitoring, we say. So in that cases, the technology is good. And the other devices, even nowadays, if we see some children, they do have asthma. So if the child gets recurrent asthma, we do have devices by which we can measure their saturation so that they can't get again and again the episodes of hypoxia, and by which their growth can't be deteriorated. So we do have such devices where technology is helping us in taking care of our kids. Second is telemedicine, of course, is good thing, because in rural areas, in remote areas, many people are not able to connect to the pediatrician, and telemedicine is good way to connect with pediatrician in case of emergency, and even for the smaller things also. The second thing is by using technology, we can monitor our child's developmental milestones. It really helps. Some apps are really good, which are helpful for monitoring how our child is growing. Even technology and apps can tell us about the vaccination schedule. So your alarms, your apps can tell you the schedule by which you want to take your child to the doctors, and even the medication reminders. Again, digital platforms are there, the digital apps are there, where your child can learn actually what are the healthy things, healthy lifestyle, like the yoga classes and everything. These social media platforms are for good things, not for the bad things. So certain apps we can use for the healthy lifestyle in kids. Even we can use technology in disabled kids, like those who are blind, those who are mute. We can teach them through the certain apps, and technology really helps them to get better education. This is most important part. Technology comes at certain cost. So for kids especially, technology is way dangerous, because their data and everything is like, really we can't rely on anything, because their data can easily be taken out. Anything can happen with that. And even the point is that we share our kids picture on social media. By the time they grow up, they would not appreciate their life on social media. Some people will like it, but some kids, they'll say ki why my whole journey is on social media. So from starting to my adulthood and everything, they may not appreciate their life on social media. So there are some challenges with technology. So last part, this is my patient who was completely drawn, and by medical facilities and expertise, we could save him and we could send him at home nicely. Thank you.
So, Dr. Ashwini sir, thank you so much once again for this lovely topic. I really like the creativity of your topic. You really made us understand it's not a formal PPT, but it's a lot about the profession that you do. Can we just honor you with a token of love and affection with small Tulsi? Please play. We've got some exciting news for everyone, that we have lunch break in next 20 minutes. Okay, so in the meanwhile, we're going to have two more speakers coming in. So give me a second. I'm just going to be arranging the PPT's PowerPoint presentation. In the meanwhile, if you would like to connect with each other and check with each other, how are you feeling at this moment? How is this experience settling with you? Would be excellent. I'd like to invite Dr. Amruta Bedekar on the stage. She's going to speak on tackling sleep deprivation in children for lifelong well-being. Dr. Amruta Bedekar is a consultant anesthetist and child sleep specialist at Dinanath Mangeshkar Hospital, Pune. She holds an MBBS from BJ Medical College, Pune, an MD in anesthesia from Tata Memorial Hospital, Mumbai, and an FRCA and from London. Additionally, she has diploma in international health system management and certifications in child sleep consultation and sleep issues for children with ADHD. Since July 2024, Dr. Bedekar has managed a child sleep health center resolving sleep issues for over 120 families. May I get an honor to invite you, Dr. Amruta Bedekar, on the stage. Thank you so much.
Hello, everybody. Are you all looking forward to lunch? So I often get asked the question that you are a successful anesthetist, you work at a hospital already. Why did you get into the field of sleep for children? So the answer to that is very simple. When I became a parent myself, I realized that this is a very neglected field, that we talk about the half of children's life while they are awake, and we look after that very well. We talk about their nutrition, we look after their wellness, and yes, of course, as Dr. Shirsad said, their vaccinations, etc. We look at where they should go to school and what they should be studying very much in detail. But all of that gets consolidated in that half of their life when they are asleep. So that is the half of children's lives that we are really neglecting. And that was the reason that I took up this additional certification, additional qualification to sort of get into this. In this conference, I think there are going to be a lot of debates about, what is the right way to eat, what is the right way to exercise. But I think nobody here will disagree that sleep is vitally important in all of these. Sleep is important in our food choices, in our exercise choices, in how well we feel that day and every day. It's important for our physical, mental, emotional well-being. It decides how we behave literally the next day. And it's important for many myriad body processes which happen without our knowledge, like in anti-aging, anti-inflammatory, anti-hormonal, anti-cancer sort of mechanisms as well. In spite of this importance of sleep in everything that we do when we are awake, there is currently a global epidemic of sleeplessness happening. if you look at surveys that were done in the previous generation when we were children, and if you look at surveys today, children all over the world are sleeping lesser and worse than just 30 years ago. And given that our biology hasn't changed, our sleep requirement hasn't changed, that is a very alarming development. In fact, it's an evolutionary first. No other species has ignored their need to rest as much as we have done in this generation. So we don't know where this is leading. We don't know what sort of impact this is going to have for the next generation. In India as well, there have been many studies in the last 10 years which are looking at the impact of sleep deprivation in children on their health. And one of the surveys which looked at preschool children, so just 3 to 6 year olds, this was a survey that included 12,000 children from India, found that Indian children are among the most sleep deprived in the world. So Indian preschoolers are clocking less than 9 hours of sleep on average. This is almost 2 hours lesser than developed countries. So we are sort of leading the world in this epidemic as well as in many other epidemics. And having read all of this as a parent, I did a local survey as well of parents in Pune, social media survey, where I found that almost half the children under 5 years of age were sleeping after 10 p.m. as their regular bedtime. Now this is very, very alarming. If you all remember when you were children, did you sleep as late as this? We didn't. We were a generation which slept at 8 o'clock, 9 o'clock, and this is where we are today. We don't know what's going to happen with our children if they do this in such early childhood. As Dr. Shirsat mentioned, the first 2 years of a child's life are very, very important in this sort of brain development. 10% of the children that I surveyed, in fact, have chronic bedtimes of after midnight. And 3/4 of the parents that I surveyed reported that their children have difficulty waking up for school or for playgroup. Now, these are really very alarming findings. What are the effects of all of these on these children? There are physical, mental, emotional effects. Almost all of these effects we have been discussing in adults thus far in this conference. Stunting, childhood obesity, early onset diabetes, heart disease, early menses and PCOD. Mental effects like effects on academic performance, language development, difficulties with task completion, focus and attention, and emotional effects like language and social skills suffer, emotional regulation and anxiety, depression, mood disorders, aggression are all higher in incidence in children who suffer from chronic sleep deprivation. Now the difference between adults and children in this are twofold. Number one, that in children, when all of these effects happen to them before 5 years of age, they are lifelong. If a child gets early onset childhood obesity, they are going to suffer from it all their life. And the second difference is that as adults, we are responsible for our own choices. So if we are sitting badly at work and we get neck pain, we are ourselves to blame. But with children, they are not to blame in this. It's their parents' lifestyle which is causing lifestyle disorders in the children as well. So this is something that we really need to correct and fast. So if you look at the causes of this sort of dramatic sleep deprivation that is happening in children today, most of the causes begin with our parents, household and communities. So our lifestyles, late work, late shifts, late dinners and non-circadian sort of rhythms that we are following are the proximate causes for these children. Screens, bright lights, the ubiquity of screens and bright lights, the ubiquity of processed food in a child's environment, the ubiquity of stress, noise, etc. in our communities, as well as the lack of activity and daylight that is provided to these children are all causes that go towards this sleep deprivation. So in effect, it's a lifestyle disorder in children. So what can we do about this epidemic of sleep deprivation that is happening in our children? So at the community level, we can educate parents, we can create awareness in the community, we can have simple policy changes. So if you all remember, it was in the news last year that there was a policy change to shift school timings later so that school children are not sleep deprived. Now, unfortunately, this is in the opposite direction, that children should actually be sleeping earlier and going to school earlier. But if they are universally sleeping later, we might as well have later schools so that at least they catch up to their sleep. So these are some of the things that can be done at community level. At our sleep clinic, we treat children at individual level. So for them, we have various behavioral interventions. We have evidence-based specific methods that we can use. And currently, unfortunately, certain children are eventually needing medication for their sleep problems. Now, this is a situation that I much strive to avoid in our sleep clinic. So since the last 1 year, we have been running a child sleep clinic in Dinanath Mangeshkar Hospital, where we get referred patients by the parents themselves or by pediatricians or teachers, etc., with sleep problems per se or problems that are resulting from the lack of sleep. So thus far in the last 1 year, we have already treated 120 cases across the age ranges of 0 to 12 years, although the commonest age that comes to me is 1 to 3 years. They are from various socio-economic and generational households, etc. They are developmentally normal children, as well as we treat children with ADHD, autism spectrum disorder, or those who are NICU graduates, or those who have frequent illnesses or allergies which are affecting their sleep. The common issues that parents approach us with are, in their words, taking time to fall asleep. So almost an hour or an hour and a half every day, the child needs to be either rocked or walked to go to sleep. They wake up multiple times overnight, as much as 7 to 10 times. They sleep very late as 2 to 3 a.m. was my latest case. They are restless and moving all night. They need odd associations. So I had a case where the parents needed to take the child in a car for about 1 hour, 10 to 11 p.m. every night, for him to be able to go to sleep. They don't wake up fresh in the morning. They have problems with language or social issues or school or aggression. And one thing that parents come to me for is their own mental health. I've been doing this for the last 2 years. I have not slept well and I'm at the end of my tether. Please, can you help me make my child sleep? So this is the issues. These are the common issues that we address. What we don't address are sleep issues which are pathological in nature. So bed wetting, teeth grinding, things like that need to go to pediatricians. They don't come to a child sleep clinic. Similarly, medical causes of sleep disruptions like tonsils, adenoids, etc., of course, go to pediatrician. So this is an example case. This desperate mother sent me this WhatsApp note in the morning that my child slept at 10, and this is what she wrote. As you can imagine, this is impossible for a parent or a family or even a child to handle for longer than 2 or 3 years. So as an example, I'll tell you about NK, a 1.5-year-old child. He was, by the time he came to me, he was resisting bedtime every day for 1.5 hours. Parents had to take him for a car ride. He had started waking up 3-4 times every night, crying for over an hour, and demanding car rides even at the time when he woke up 2 a.m., 3 a.m., etc., just to go back to sleep. And he had landed up in the emergency room 2 or 3 a.m. because he was inconsolably crying. So he was not eating well anymore. He was cranky most of the day, refusing to go to daycare and upset if he met strangers. So this is one of the really extreme cases that came to us. And these are the things that we did for him. So in week number 1, we mainly address sleep hygiene, nutrition, daylight and activity, screen time, and sleep environment. So we do around 1 hour to 1.5 hour consultation for them, where we tell them what are the age appropriate ways of adjusting this child's lifestyle. Often it's more about adjusting the parents and the household lifestyle for all of this. In week number 2 and 3, we do certain evidence-based behavioral interventions, which are graded changes in non-circadian schedules, fading or replacement of odd associations. For example, in this instance, the car ride, faded bedtime, scheduled awakenings, positive reinforcement, reward charts, etc. On only one occasion out of these 120 cases, I have had to use one of the methods that you may have heard of, which is ferberization. On all other occasions, I have not had to use any of these methods. And the 4th week is spent in consolidating whatever gains we get in the first 3 weeks with habit building and communication with kids about sleep. Yes, children as young as 1 to 1.5-year-old do need communication about sleep and how to deal with disruptions like sleep, like school or holidays, etc. So that's in short about the work that we've been doing for the last 1 year. If you'd like to hear more about this, there are a couple of YouTube podcasts on the issue of child sleep, and that's my clinic number.
Thank you so much once again. So, Dr. Amruta, I have a question for you. One of the times I was at the airport, international airport, and parents have given their children smartphones. Okay, and they were completely busy. The children were busy in their mobiles, and they were fighting. So, how do we address issues when it comes to, because it's not about child sleeping, it's also how the child is perceiving the concepts of sleep. Because if there is energy around, which is a lot of anger, so what do you do in such times when we have parents very dysfunctional, or maybe children are unable to sleep? I'm not talking about just 8 or 9, maybe around 12, 14 as well. Yeah.
Sure, thank you. That's a good question. So I'll answer that question in two parts. Number one, the ubiquity of screens. So screens are not just affecting sleep, but as you described, when I was younger, I think an airport was a very exciting place. You could people watch, you could look at somebody's hairstyle, you could look at what people were talking to each other about. And today's children are so engaged in their screens that they are missing out on developing these empathetic skills and these sort of skills of observation of things around them. They are not even getting bored, which is, the root of creativity. So screen addiction is the number one thing that we need to address for children across ages, which is a really difficult thing to address, but it needs a lot of effort from the parents as well. The second thing, as you are saying, yes, there is a lot of dysfunctionality in parents and families and households, which is then affecting the child's nutrition and sleep. So when people come to me, like I said, we need to sit down with the whole family. I sometimes ask for the grandparents to come for the consultation as well, the parents and any additional caregivers like nanny, etc. Because all of their efforts are required. I say that for 1 month, this entire household has to be focusing only on the fact that my child has a problem and we need to solve it. So no late nights, no strange gatherings. You focus on building a healthy lifestyle for the family and for the child as well. And eventually what happens is that these people get back to me after 2 months and say that you didn't fix just our child's sleep, you fixed our entire family's sleep and lifestyle.
Thank you so much once again. I think it's a cultural issue, not just at one level at a family. So thank you so much. We would love to appreciate you with a token of Tulsi. Yes. We have some questions from the audience. Excellent. Yes.
Thank you so much, Dr. Amrita, for bringing such an important topic. Most of the parents like me would agree with this, that the children need to have a very healthy sleep pattern. I would like to have a question to you, like when we were growing up, we always used to hear that early to bed and early to rise makes us healthy, wealthy and wise. But as we are growing and when we see our children growing, like I have got a teenage daughter and she finds, like she sleeps around 12, 1 o'clock, sometimes 2 a.m. and she finds studying very, very important and very engrossing after midnight. And she seems like the environment is very serene, you can focus more, and it is just not with her. Like she's studying at BBA at NMIMS, one of the India's coveted management institutions. And there are so many children like her who are doing the same. And we have so many studies across social media that states that you need to understand your sleep pattern and you need to give your body your time. But at the same time, we hear that early rising is very, very important. So in this contradiction, would you like to throw some light that what is good for adolescent, especially our teenage children? Thank you so much.
Wonderful question, wonderful question. So I'll answer that again in two parts. Is it good to have an early to rise, early to bed sort of pattern, and what happens in teenage? So it's all very well to say that sleep patterns can be individualized, etc. But we are all one single species which evolved to go with the phases of the sun. We are very, very circadian beings. Not just by circadian, I mean so we have patterns that go along with the sun. Not just our sleep physiology, but every single system in our body, digestive, renal, respiratory, is all geared to function best when there is sunlight and not function when there is no sunlight. So even if we think that our sleep pattern is that we sleep best at 9 o'clock, ideally, evolutionarily, we sleep at sunset and wake up at sunrise. And at least in the first 3-4 years of a child's life, this is vitally important. So they must sleep. In fact, in not just my own children, but few of my patients' children as well. My children are 4-5 years old and they still sleep at sunset and wake up at sunrise, and they don't see artificial light at all. Okay, so that's how a child's brain develops best. However, in teenage, the entire melatonin secretion, the entire secretion of the hormones which drive sleep itself phase shifts 3 to 4 hours later. This is a natural hormonal occurrence which occurs at puberty. So if adolescents say that they are going to sleep late, post-pubertal children say that they're going to sleep late and they are a bit defiant, I would accept that. So early to sleep, bed early to rise must happen for early age children. Later, after puberty, they do need to go to sleep slightly later.
Thank you once again. Was your question answered?
I wanted to know about your experience about the sleep disturbances in below 1 year of child, and have you seen such cases and how you solved it?
Yes. So there are again 2 phases in under 1-year-old children. Till around 4 months of age, babies have no concept of day or night. Melatonin secretion doesn't start till 4 months of age. So before 4 months, they just go in 3 hourly cycles of eat, poop and sleep and eat, poop and sleep. Beyond 4 months, up to 1 year of age, melatonin secretion does start and you can get to some sort of predictable day-night rhythm. Now, the problem cases that I've had under 1 year are mainly complete day-night confusion. So even beyond 4 months, a child sleeps all day and is awake all night. So that is what I help to address by graduated sort of circadian correction. And the second cases that I get are that even between 4 months to 1 year of age, during transitions like 3 naps to 2 naps, 2 naps to 1 nap, all their entire routine gets disrupted. So complete day-night confusion is more commonly seen in children under 1 year of age.
So I just need to a little contribute what she was mentioning about the circadian rhythm and to her question related to the teenagers. So being a practicing medical nutrition therapist, I do believe that even if your child is at a stage of puberty and because of the hormonal disturbances, that's what puberty is all about, they are not able to sleep on time and because of the load of the studies. Still, I do certainly believe that inculcating circadian rhythm is important because no wonder the sleep is disturbed. That is why 18 to 25 has become a major age for PCODs, PCOS and so on.
So true, so true.
Yeah, because one day they will become adult and puberty would be gone. So
true.
Inculcating, right, so that they don't see the sun for them like at 11 or 12. So yeah.
So
thank
yeah,
you.
I agree. The shift should be from 7
Right.
a.m. to 7 p.m. to 10 p.m. bedtime.
Correct,
If
correct.
the original bedtime is 10 and then the phase shift is 3 hours, then they'll end up sleeping at 1 o'clock.
Right. Thank you.
Thank you so much for your contribution as well. So before we could take our lunch, we have a last presenter before lunch. Our next topic is going to be on innovative cancer treatment and pain-free care, the future of oncology. I would like to invite Dr. Sachin Nandekar, Founder Director of Holistic Cancer Clinic, Pune. Dr. Sachin is an expert in Ayurveda for over 21 years of experience, including pulse diagnosis, leech therapy, and therapeutic panchkarma treatments. Has benefited countless patients both in India and abroad. With a strong presence in international conferences and media, he brings a unique blend of traditional wisdom and innovative approaches to cancer treatment. I welcome Dr. Sachin Nandekar. Please come.
Namaste. First, I want to say thanks Team Pearson, Shekhar, to invite me to give some words on this topic. As earlier speaker said, we are so much exposed to radiations nowadays. There is lack of nutrition. So that's why what is happening? There is like an epidemic, cancer is happening and cancer is increasing. So like innovations in the cancer in the another way, like we know innovative oncology, invasive methods of oncology are developing. Medical science is emerging fastly. Are we able to stop cancer epidemic only with these invasive limitations? What are the answers? Like one more story to start. Like 18 years back, I have one patient diagnosed with HIV. And I have one student from Yale University, US, to do research on HIV. We started treatment on that HIV patient, but intermittently, that patient is diagnosed with respiratory cancer. She is followed up with Tata Institute, and merely 8 months prognosis is like diagnosed. But after that, she started our holistic treatment, and after that, she lived like her normal life till 12 years. One more story regarding like 2-3 days back, Atul Parsure, friend of mine, like diagnosed with cancer, in his individual opinion, there is misdiagnosis and treatment. Then he shifted on homeopathic treatment, recovered well. And he already said in interview, I am recovered well, but no. Cancer, like deceiving diseases and conditions, patient or doctor feels the patient get treated well, but condition occurred again, and he is no more love. Day by day, many celebrities diagnosed with cancer. So we have one part emerging invasive type of treatment, and nowadays next treatment protocol, holistic treatment protocol is also emerging in the trends of cancer. So some little comparison between holistic and non-holistic, invasive, non-invasive. Observation versus experiment. Experiment requires many investment. Experiment requires cost, but observation, it differs than experiment. Another benefits regarding comparing holistic type of treatment is it is organic and toxicity free, easy to continue, it is cost effective, sophisticated. Nowadays, advancement in holistic cancer treatment, it is sophisticated and tailor-made. What is the role of holistic cancer treatment? What are the scope of holistic cancer treatment? Like patients are not able to take conventional treatment like chemotherapy, radiotherapy, like old age patients like above 75 years of treatment, certain limitations like low platelet counts. Holistic innovative cancer treatments supports patients, provide them good care for the recovery of their cancer conditions. So basic fundamental role for the holistic cancer treatment is Swasthasya Swasthya Rakshanam, Aturasya Vyadhi Parimukshanam. Prevention better than cure. So catch them early. With the cancer treatment, we have one website called as hidegrow.in. So what we do, patient having major family history regarding cancer, patient having major history like tobacco or nicotine intake, patient having lifestyle hazard history like vulnerable chemical contacts, we provide preventive holistic therapies. We developed preventive holistic cancer protocol for all other patients having like fear regarding cancer. In that, patient visits our clinic 30 to 40 minutes for 40 days. And with these holistic preventive cancer therapies, the chances are negligible to diagnose a cancer. So even for the preventive aspect, holistic cancer treatment or therapies provide best option for these patients. Innovative cancer treatment, there are two types of holistic cancer treatment, internal as well as external. In the external treatment, we set up holistic cancer protocol, detox protocol for 7 days and growth protocol for 7 days. Pain management in cancer, what is the basic etiology regarding pain in cancer? So according to holistic principles, one is deficiency-induced protocol, other is obstructive protocol. So for the deficiency-induced protocol, in the non-obstructive or deficiency-induced pain protocol for cancer, we developed certain therapies like Basti or Dhara treatment are given to the patients, and fastly or accurately pain is managed in these kind of conditions. In the obstructive conditions, treatments like leech therapy or Jalavka, Agni Karma, this type of treatment manages patients' pain very well. Holistic innovative cancer pain-free care, what protocol we set for cancer patients globally is fast, accurate, safe, and it treats the patient's symptoms from root. So reoccurrence of a cancer, like in a Atul Parchure case, like there is a reoccurrence, sudden reoccurrence. There is strength of holistic cancer preventive protocol. Like we are far more successful to stop the reoccurrence of cancer patients. And finally, these are the kind of therapies, innovative therapies we develop for holistic cancer care patient. These therapies patient can visit in interval when like conventional treatment like chemotherapy or radiotherapy or surgical intervention get completed. In interval, to stop reoccurrence, to get strength back of that patient, we perform these kind of therapies. Like basically for the pain management, there are many number of therapies in holistic cancer protocol. Like leech therapy is very good for pain management. Then Svedana is there, then Agnikarma is there, then Lepa therapy is there, then Vidya Chikitsa, Vidya Karma is there. Like in the photo, like patient having complaint regarding his cerebral tumor, patient's photo is there. So we do Vidya Karma, so that manages pain on the emergency basis as well, without any painkiller or without any side effects. Then in Metas, one patient, that spine busty, the spine secondaries are in spinal cord, cancer secondaries are there. So with the spine busty, back pain, complaints like back pain or shoulder pain, that vanishes completely. Head, for the headache in the cancer patient, Dhara therapy or Nasya is also very much beneficial. What are the coming to the results, like our experiences in certain patients? One patient like Mr. Singh, he is a male, 55 years, just detected oral like lesion on his tongue, having a major history of tobacco consumption, and advised to go for investigations. But before that, he visited to us, gone through 6 months completely holistic cancer protocol, and his video is live on our YouTube channel, Holistic Health. He is completely recovered from that. And his basic investigation, he is still live, normal, living his normal life. Another patient, Mrs. Joshi, she is 76-year-old patient. She had diagnosed tumor in humerus, gone through the surgical intervention. After surgical intervention, completed her conventional treatment. Then she is 6-month treatment, cancer protocol, holistic treatment. Then she is living her normal life without any reoccurrence. Her follow-up scans are completely normal. Last but not least, Mr. Raje, 44 years, lymphoma, non-Hodgkin's lymphoma diagnosed patient, gone 2-3 years complete conventional treatment, then unsuccessful bone marrow transplant. Then last 1 to 2 years, he is in follow-up with us and he's living completely normal life. Even our holistic cancer protocol treatment, we are tapering off his treatment also, and he's completely living normal life. So like with the conventional medicine, there is bright future for holistic oncology regarding balancing cellular metabolism, organic food and medicines, stress management, diet, lifestyle, root cause care, detox protocol, fitness, so many things. What we consider brightness in future of holistic oncology is all-pathy garden, like patient first driven policy. So according to patient's condition of that cancer and according to stage of a cancer, whatever much more needed to that patient, that should be given. And with this, the cost effectiveness, with this the quality life assurance is beneficial. Like through our holistic cancer protocol, we provide all stage cancer treatment. In the stage 1 to stage 2, patient recovers completely and there is hardly chances to reoccurrence. And in the end stage patient also, we can assure patient quality and quantity life with our herbal holistic cancer protocol. Thank you so much.
Thank you so much, Dr. Sachin, once again for your sharing your traditional wisdom and innovative approach towards cancer treatment. I'd like to ask anybody would like to have any question for Dr. Sachin.
The stage, first stage, second stage, third stage. Is it good for third stage cancer?
Very good question. Actually, earlier I already said, like we set up an holistic cancer protocol for all stage patients. Like if catch them young, early detection, early treatment, the chances of recovery or 100% successfulness is increased. So in the first and second stage, like 100% recovery rate is there, or hardly there is any reoccurrence in out of 100 patients, 90% patient hardly there is any recovery. And talking about when the stage gets upside in the tertiary stage, like nearly 40-50% of patients recovered fully and there is no reoccurrence if they follow our holistic cancer protocol. And at the end stage, what we can do pain-free life, normal life, quality quantity life get assured in that patients.
I'm Dr. Ashish Pangar. I'm surgical oncologist.
Yeah.
So I'm pretty much dealing with the cancer things day in and out. So in your 3 examples, you are said oral malignancy, oral. If early lesions, I agree with you. If those are not malignant or very small early changes, you can take help of the holistic approach. But for solid organ tumors, in second example, sir said, for tumors which are visible or detected on scan, we should go first for surgery, and later on definitely we can take help of holistic approach.
Yeah, and with I have one patient of liver tumor. His reports are there. He had not already doctor said tumor in the liver is a hardliest condition in oncology. Prognosis is merely 6-8 months. So I have one patient from Kolhapur. His age was 40 years and he have tumor in liver. He is not hadn't taken any choice regarding surgical intervention because there are many metastases, many conditions. So hardly there is 6-8 months prognosis. But he followed vigorously 8 weeks only diet, exercise protocol, therapeutic protocol, and medicine. So I have patients reports within 8 to 10 weeks, 40% of size reduction of tumor is there. So even that is also possibility. Only proper documentation is needed, proper follow-up is needed, and even major tumor that I have yesterday one case it is pancreas tumor and intervening and bilirubin level is increasing day by day. So definitely there is stent is needed, stent to be or surgical intervention is definitely needed. So holistic approach of a cancer is benefits patient. Why? Condition of the patient, which pathy treats him best will treat him best. So when surgical intervention is needed, definitely there is need of a surgery. Past surgery recovery and further stop the growth of that condition or to stop the metastasis, holistic cancer protocol suits best.
Especially ladies. At the age of 32, she died. And someone died at the age of 80, someone died at the age of 65, facing all cancer patients. So what is this? Age or hormonal changes or due to menstruation? What it is exactly in ladies especially?
Yeah, according to holistic way of approach, metabolic waste is created in our body. Certain patients have certain food or lifestyle etiology that gets stopped properly. Yesterday's patient, bilirubin is increasing and he's having very foods like green chili, having very large intake in his diet, her patient's diet. So if we get proper etiology, so there is 30-40 minutes detailed case taking and consultation is there. We come to know that cancer etiology of that certain patient. So once that get tracked properly, we stop. So in holistic approach, if you stop root causativity of that disease, that is half treatment, 50% of treatment. If that stop, then there is no etiology, then there is no growth of that condition or metastasis. That is very much important to stop that. And even if patient is not willing to stop that etiology, like one smoker is there and is not willing or able in a position to stop smoking or tobacco, then we have detox protocol. So patients visit our clinic, we detoxify his body tissues, certain body tissues. Or patient is alcoholic, so liver detox is there. Patient is on smoking, there is respiratory detox. Patient having cerebral tumor, we have certain detoxes developed according to condition. So holistic cancer protocol is not a general. It is depend on patient's age, sex, diagnosis of cancer, condition of cancer, organs which are involved in that cancer. According to that, we can set growth or detox protocol in that patients. So with this, like, we can ensure quality, quantity life of that patient.
First of all, congratulations to you that you are contributing to non-invasive kind of procedures for cancer patients. I'm a little curious to know that in your clinic, what are the exclusion criteria that you won't take these patients? And plus, if you could just share maybe 1 or 2 limitations what you have come across while dealing such kind of patients. Because whenever we see some kind of a therapy, one limitation which I'm sure all would agree upon is dropout rate, or sometimes being non-credibility kind of a mindset after some point of time. Just wanted to know your view.
Yeah, very nice question. Like, all this treatment we provide currently on OPD basis. So patients which need hospitalization or patients need surgical intervention, that should be get admitted to like proper in IPD setup or done surgery. So these all treatment we do for the patients which are at home, or that treatment should be done on the OPD basis. This is the basic limitation for the treatment. And another thing, like patient like going on, like started any other treatment, like conventional treatment is going on, like chemotherapy or radiotherapy or other surgical intervention. In that, like detox protocol or growth protocol, therapeutic protocol is not possible that patient. In intervals we can give, but like with the any other kind of medication or treatment, our internal medications patient can take, or we have developed certain creams or any like herbal formulations in the form of tablet which are GMP certified, or that are also condition specific, that can patient continue with that kind of treatment. So only patients needed hospitalization. This treatment, all treatment we do on OPD basis, and even with that, with proper oncologist follow-up also. The ex-patient have his own oncologist, or ex-patient have his own surgeon. So with his guidance and follow-up, he is giving his follow-up to that surgeon or oncologist also.
Thank you once again, everybody. Thank you, Dr. Sachin, for your wonderful contribution. And we'd love to honor you with a small token of love and affection from us. So it's time for us to go for the next 5 presentations, because we have now got out of our lunch break. The lunch break is over. So now we'll be starting with the next presentation. Are we ready for that? Look at your faces. We will. So let's do one thing. Let's take a 45 minutes proper lunch break. Okay. And then we come back here maybe around 2:30, 2:35 max. Okay. Are we ready for a 45 minutes break or a 30 minutes break? But the kind of questions you're asking are amazing. My 10 minutes are going to 15 minutes. So I'm sure you're amazing people here. So 45 minutes break, and I'd love to see you back again. Thank you once again. Cheers.